So men's perception of mental illness is very, very different from general population and females, very different. The few things I've written, male characteristic, we tend to be macho. I'll be all right attitude, I'll be all right mind, I'll deal with it. They don't talk. Men generally don't talk, don't open up. And this the macho attitude actually does not help at all in psychiatry, because ultimately leads to the downfall. Expectation from men to be a man, to be a leader. Keep pulling, even however hard it is, keep pulling. Men are seen as provider, even if they are not confident or not capable due to various reasons, but expected to just keep going. They men then not to show emotions. And hockey players, all of you get injured so badly, and we don't see a wince on the face. And cricket field, I know that when you bouncer hits the head, they don't wince. So men that don't show emotion, that's sign of weakness. Men are not supposed to cry. That is all we have inherited genetically for ages. Although you're crying. So even if you fall, as I've shown here, don't cry. Denial of depression, blame it on other factors. Oh, I had back pain, that's why I'm feeling low. No, I'll be all right, mate. And at work, if you say you're depressed, you're considered weak, and you don't get respect, you continue to stress. You can, and then you get unlucky with the bosses. I have seen, I do some medical legal cases also, and I do a lot of work cover assessment. And the amount of negativity from bosses, colleagues, to workers suffering from depression and all is just amazing. It just belies belief that it's happening in Australia when I do work cover. And they're depressed, and then they're like taunted so badly, bullied and harassed just for mentioning that they cannot cope. And all sorts of street language are used in workplaces. Men can be depressed due to family pressure, spouse difficulty, midlife crisis. And a lot of time, anything in the world can affect us indirectly. All prices go up in Russia, and suddenly we can't afford petrol. Our family expenses go up that month by $200 or $150, and suddenly all comes to you. And you just try to meet ends. Now, a lot of times the men are confused. Why am I having some good days and some bad days? They don't understand why it's happening, because we tend to be seeing everything in black and white. Like we say, women have gray areas, we have black, we are very black and white. So they can't understand they're feeling low, they lack of motivation. They can't understand that there can be depression also. But they say, look, some days I wake up better, some days I'm not motivated. They're scared is what is happening to them, because they don't understand. And then they justify by saying, no, but only 3 months back, I was a very strong person, but I can't understand why I can't cope with simple thing. I'm getting anxious driving in the traffic, whereas I could drive anytime. And then a lot of time, why me? I was such a good, strong person. And they have all these questions, but because they are apprehensive of asking this question or sharing with other people, they miss out, and then they just keep negative thoughts. Their negative thoughts keep brewing inside, and there's no outlet. And one thing I would mention at this time, that emotions are such thing that it can only go up to a certain level, and then it has to spill over. So you're emotional, and then spill over. Now, spill over, the best way of spilling over emotion is talking, and it releases the pressure. Other ways, people devise their own way. They get anger, they use punching bag to release emotion. They do all sorts of aggression, suicidal thoughts, self-harm. But ultimately, we should understand that emotions has to be released. It can go up to this place, and then it will spill over. And if you don't spill over by talking, which is the best way of spilling over, then you'll get anxiety symptom, depression symptom, anger, agitation, restlessness, and you'll do wrong things, alcoholic, drugs. So it has to be released. Dilemma seeking help in men, and I've seen in Australia, I've been here for practicing for 26 years, sign of weakness. No, and they will say, look, I'm brought up in generation which you don't mention depression, and you'll be seeing weak or wuss or all those language. Stigma, you'll be called as mentally ill. You've got mental illness. And some places, even though we are in 2022, we expect that we have advanced, we have better understanding of psychiatric problem. No, absolutely not. Lot of organization, especially blue collar jobs. You mention depression and you call all sorts of names, street names. That is not funny. There's a lot of stigma. They hide there, and other colleagues may not understand it. You say depression, I don't know what depression is. And then the biggest thing, they think what people would think about it, or about you. Now, at this point, I want to mention, I have a belief that the biggest illness in this world is what people think about me. As soon as you remove that and you be true to yourself, a lot of stress goes away. But we always, oh, if I do this, what would they say? What would colleagues say? What would my children say? What would people think about me? Is that's my way of saying, is the biggest illness in the world. How men deal with it? The pent-up emotion leads to final anger. The anger explosion, fighting, irritability. Most of the time, you're snappy at your partner, take out snap at your children, aggressive behavior, road rage, fighting with people, reckless behavior, drinking, taking drugs, all those things. And some people go out and have affairs to forget their own problem. It's something exciting, I'll forget depression. Leaving home, separating for partners. Some people think that's very easy way. And sometimes they leave job and they want to have a fresh start and feel that will change. But if you have a depression, then that's not going to change. Now, at this point, I also mentioned there are two types of depression. All of you are listening. If you can understand the basic thing, a lot of things will be cleared up. Depression has two types. One is called endogenous depression. Endo means within the body. So depression within the body, where there is a chemical shortage of serotonin. So serotonin goes down in the brain. Serotonin is a happy chemical and you get depressed. And we give antidepressant, which are serotonin stimulator. They increase the serotonin and all good. That is called endogenous depression, which is within the body, or it's also called chemical depression. This is not as common as the other depression, which is called reactive depression. Now, reactive depression is depression due to external factors or internal factors. External factors mean bullied by boss, having financial difficulty, relationship difficulty, and you are depressed. That is in reaction to something in your life. Or internal factors, you've been diagnosed with cancer and given 6 months to live, you're depressed. In reactive depression, medication don't work as much because it is not chemical depression. So treatment is, and you see, unless you're very clear, you go to GPs, doctors, they start giving depression tablets. But when your serotonin is not down, antidepressant don't work. And by the time you're referred to us, GPs can give 4 or 5 types of antidepressant. Or this is not working, give this. This is not working, give this. Ultimately, nothing works because it's not chemical depression, it is reactive depression. Treatment is a bit of antidepressant, but treat the cause. If there is issues with your wife, have couples counseling. Issues with your boss, have meeting and conciliation. So treat the cause. So that we need to understand very quickly. Now, consequence of untreated depression is your behavior, and behavior leads to separation from a wife or partner. Financial hardship increase because you spend money on alcohol or drugs, or you have absent days at work, you don't attend. And partner and children are affected psychologically. Children are just hiding in the house. They're just keeping away from you because you are angry in the house. Partner also get depressed because unless you are happy, the whole house is not happy, they get depressed. And you then finally you lose everything you worked for. The quality of life is affected. And then this consequently can lead to worsening of depression. Then you start to having low self-esteem and self-confidence, feeling of guilt that I don't know why I shouted at my children, I'm doing something wrong. They have not done anything wrong, it's me. Self-depreciation thoughts and suicide attempts. And suicide attempt, or also I should add self-harm attempt. Self-harm with alcohol, drugs, cutting themselves, and actual suicide attempt, thoughts of suicide and suicide attempt. But everything is not lost. What you do when you do not have petrol and you have to go distance, try anything that is positive. You have no energy, try something. Talk to your best friend. Tell your spouse that you are feeling very low, you don't know what to do. Allow people to take over. Okay? And spouse might ring a doctor. Contact your doctor, that's the best thing. All GPs now understand depression. So try something. Even a phone call to your best friend might start a big chain of events where you can get a lot of help. I see this happening a lot of time. When they don't talk to anyone, they ring a friend and suddenly a friend contacts the GP or friend contact us. And they bring us the people. And in fact, from your organization, someone is bringing a patient to me because he doesn't want to come. So I'll be seeing them in a week or 2 weeks' time. So try anything to seek help. Everything is not lost. Or use other strategies to keep moving, to support yourself and decrease the stressors. What to do? Talk to your confidant, as I said, or a GP. It's very, very important. You need to talk to someone. And that is the starting point to seek help. Okay. Acceptance of the illness is key. Next step is you accept that you have a problem, accept that you have depression. And that is a very big factor in men. They don't accept that they are depressed. They don't like to cry. Women very easily. They'll cry and say, I'm not feeling good, I'm feeling low. Emotional catharsis is great. Catharsis means letting out your feeling. Sit with a friend, talk about how you're feeling. And then you feel lighter. As I said, when emotion get filled up to here, it will spill over. Best way is to talk. If you don't talk to your GP, talk to a friend, but talk to someone. And then when you talk to GPs, then the help starts because GP know everything here. They can refer to a counselor, psychologist, or psychiatrist, depending on your needs. And then discuss treatment options, which is counseling is number one, psychotherapy is through psychologists, medication, and GP might talk to you about exercise, gym, yoga, meditation, mindfulness. Those are strategies to help. Now, counseling also, I want to tell, there are 3 levels of counseling type of help which you get. Their basic level is counselors, then next step is psychologists, and finally it is psychiatrists. So counselors are people who get training for between 6 months to 2 years, and they do counseling. Counseling is basically, you talk to them about your problem, they interpret your problem and put it back to you as options. They are not, and please be sure, counselors are not there to treat you. They are only to counsel you. For treatment, it is next level, which is psychologists. Psychologists get training for 6 years training to become a psychologist one-to-one. They are there to treat you from a psychological perspective. When psychological help is not obvious or there's no improvement, then we send to psychiatrists where we can add medication, mood stabilizers, and antidepressants. And one thing is like pregnancy, you can hide it up to so far, ultimately it will come out. And then I see a patient coming in, the family are stunned. Oh, I never thought my son would have a depression. It's just when he attempted suicide, then when we talked, then he said, last 3 years I was depressed. So it will come out anyway. instead of it coming out in a crisis situation with some harm to you, it's better to talk. Finally, remember that even if you're back to wall, instead of saying, I can't do this, say, how can I do this? So never give up and say, I cannot do this, and you resort to self-harm and suicide. How can I do this? Okay. In last 2 or 3 years, with COVID, things have actually gone very worse. And mental health problem, I would say, what is the biggest. It's amazing that all profession got affected, but we were absolutely full. Our hospital had 100% occupancy during COVID period because there were so many problems. A lot of problem were due to isolation, especially young people. Can you imagine you locking up a 16-year-old in a house for 4 months? They were just getting crazy staying in the house. And a lot of people lost their jobs. So we saw a very funny phenomena. People started drinking alcohol. Now alcohol would be delivered at home during COVID time. The alcohol problem increased, drug problem increased. Then when state governments announced that you cannot go more than 5 kilometers, so then the drug chain stopped, because to procure drug, they have to go beyond 5 kilometers, and they were not allowed. And they suddenly had withdrawal symptoms from the drugs, and they ended up in hospital. We were managing withdrawal symptoms. And a lot of domestic violence happened because of depression in COVID. So yeah, that is the formal part of it. But what I want to say is that talking to a confidant is the #1 step towards treatment. Yeah, I was seen in sports people, in cricket, hockey, soccer. We come to know very late, and then one day they are on leave, and suddenly they say, I was suffering from depression. And they came up very late when it started affecting their performance. I still remember the cricketer from England was here around 7 years back, and half a series he just left. The spinner, it was spinner, Graham something. He said, I'm mentally not well, and he's left. They leave it too late and try to struggle and fight till they are down and out. So please speak up. That's the first step. And then help is there. Thank you.
Wonderful. Thank you. Thank you so much, Dr. Shashi Varma. That was indeed very, very insightful, and really enjoyed learning about the nuances of the different types of depressions that you mentioned. Obviously, the endogenous and the more reactive depression, and antidepressants aren't always the solution. And it's important to really understand what type of depression a person has. And I think the key message that you wanted to kind of give our viewers was about having an outlet, any kind of outlet to kind of reach out to a friend, talk to someone. That's kind of the best way to kind of open up and tackle your mental health challenges. And it was also nice to kind of learn a bit more about where to reach out for help, the scope of practice, the different layers, and how GPs can direct you depending on your needs. We've got counsellors, psychologists, psychiatrists like yourself. So it's important to really understand who to go and reach out to help for as well. And something that really struck with me was about when you mentioned the biggest illness is when you always think what other people think about me. And that's certainly one that all of us should start focusing on ourselves, on our lives, and not taking external feedbacks in a negative manner. So really, really surprised, yeah. We really enjoyed listening to you there. We will have a Q&A at the end of this session. Yep. And we might have some questions come in through the Q&A chat box. So just the viewers on Zoom, there is a Q&A chat box at the bottom. So if you hit on more, you'll have a Q&A section where you can send through some questions. And if you're watching us live on Facebook, feel free to type it on Facebook as well, and Akshay will redirect them my way. Now, we do have Joshi with us. So Joshua Simmons, bit of an introduction for him. So he grew up playing and competing in hockey, representing his home state of Victoria. So we're always very proud of him. He made his junior international debut in 2015 at the Sultan of Johor Cup, playing in the under-21s and finishing 5th. At just 20 years of age, Josh scored in 3 games for Victoria Vikings on our way to the 2017 Australian Hockey League gold medal over the WA Thundersticks. So his performance this game confirmed that he was certainly someone to watch out for. And he made his senior international debut in 2018, playing a test match against Argentina held in Darwin. And in 2019, Josh won gold at the FIH Pro League final in the Netherlands, following the 3-2 win over Belgium. He's also made his Olympic debut at Tokyo last year and will soon be on a flight to Birmingham, representing the Kookaburras for the Commonwealth Games this year. So we're all really excited and looking forward to hearing from a local hero. Josh Simmons, over to you.
Thanks very much. So yeah, I think I'll give a little bit of an introduction about myself. So I started playing hockey when I was 11 at my local club, Doncaster Hockey Club. I still play there to this day. I went through all the junior ranks, made quite a few state teams, like I'm sure some of the kids that are listening here in those fortunate positions at the moment. Under 12s, I think was my first side, 13s, 15s, and 18s. The big progression for me came when I took the step to under 21 side, so going from a junior hockey to a bit more of a men's senior kind of format. And I was fortunate enough to make my kind of junior national debuts and get the foot in the door that way. As you said before, back-to-back AHLs in 2016 and 17 was a big step for me, going through to the national development squad, and then from there, ultimately making my Kookaburras debut. You touched on a few highlights there, but a big one for me was silver at Tokyo last year. Obviously, a dream come true to make an Olympics, but to have a silver medal is quite a highlight on top of that. And then obviously, Pro League 2019 was my first big major win. And then Commonwealth Games coming up in a couple months. I think before I touch on like some mental health issues, I think being in a daily training environment in Perth comes with a lot of positives and then also a lot of negatives. And a lot of the negatives are centered around mental health issues. If I just touch on a few, you've got things like daily pressures of training. Every single session for us as Kookaburras is a selection opportunity. Obviously, then touching on that, the missed selection. And then a big one for me, being not based or not originally from Western Australia, is being away from home. So I think the big one that elite athletes face is the missed selection, and something that really helps me cope with that and not get dragged down if I am unsuccessful, and I have been unsuccessful in plenty of selections over my career, is I really have an attitude of no regrets and putting 100% forward in every single possible session, game, selection, anything like that. And then at the end of the day, I can have that no regrets attitude and say, well, if they didn't pick me, I just simply, I know it's blunt, but I simply wasn't good enough because I put 100% in. If I know have full interest or put all interest in it, and then they don't get selected and they have a lot of regrets. I think that attitude for me helps a hell of a lot, and means that, at the end of the day, if I didn't get selected, I don't get down from it and I can move on and hopefully get selected again. Time away from home is a big one. And a coping mechanism for me is that I always try and have a date where I have to look forward to getting back to my home state of Melbourne. Whether that might be simple things like at the moment, I've been away for a few months, but I know after going to Europe, I know that I can come back and play home final series for Doncaster. So that's just a simple thing that is a light at the end of the tunnel, and can keep me kind of pushing forward. I think one thing that I've been fortunate enough in my career so far is that I haven't had a huge amount of mental health issues. But I also think the reason for that is that I've had some good coping mechanisms. And this is something that we talk a lot about in the daily training environment in Perth, and Kookaburras in general is having these kind of coping mechanisms. Touched on before in the previous presentation about having a confidant or talking to someone. And for me, that big one is family and friends. And it should be for a lot of people. They are who know you the most out of anyone. So they're the ones that can give you the best advice or the best solutions, or, you know, anything really. And I think that's something that I've definitely drawn on a lot, especially being in Perth. My teammates, major bonus of hockey is that it's not like athletics or tennis or golf or something like that. It's a team sport. So you have, you know, for us, at least I have 26 other people in the squad. 22 of those people aren't from Western Australia. So there's a lot of people going through maybe exactly what I'm going through. So if you can kind of talk to those people, they have similar experiences. They might have gone through it and gone to the other side. They might be in it with you. And you can kind of like shoulder that and halve a problem by talking to someone about it. A big one we talk about, and we have a person who looks after our culture side of things in our Kookaburras program, and he talks a lot about a third place. So obviously you have your work, your hockey, and a lot of the time they're the one thing or the same, and then you have your third place. So it might be a lot of the guys in Perth love going to the beach. A lot of the guys love playing golf. It's escaping from the environment, the intense environment that is hockey. And it's kind of like, yeah, like I said, escaping for it. So one of my big things is a mate of mine, Johan, who's the goalie in the squad in the Fraley Victorian. We love playing squash. So we will play squash once or twice a week. We never, ever talk about hockey when we play squash. It's kind of just an outlet. We joke around, smash balls against the wall, and kind of it's a big outlet for us. I spoke about it a little bit before. That attitude of a light at the end of the tunnel, or glass half full, is a big one for me. I know from speaking from experience last year, my partner and family were stuck in Melbourne and I was stuck in Perth with the borders. The big light at the end of the tunnel, or the carrot kind of dangling at the end, was the Olympics. So, you know, not seeing family, partner, friends for, 4 or 5 months can be tough, but I had that goal, purely blinkers on, going to the Olympic Games. And I think if the Olympic Games wasn't there, it would have been really, really tough for me. And I probably, to be honest, it might have been a bit too much. But for me now, that goal or that carrot is the Commonwealth Games, so I can spend some more time away from home. So it's about really having that goal for me. And like I said, that light at the end of the tunnel. And I spoke about a little bit there as well. People talk about work-life balance or not bringing work home. When I'm away from the hockey field, I don't really like to talk about hockey. My family and friends will know that, especially like if we're having a social gathering or something, I don't want to talk about, selection. I don't want to talk about that game or, all those kind of things. So it's just really about escaping for me. And like I said, squash is a big one for me. A lot of the guys, like I said, like to play golf, but it's really switching off and not letting those issues that might be at the hockey field come back with me. But if I could just give one word of advice, it would definitely be to talk. And it's really okay if you are having some issues. Like I said, if you talk about an issue, often or not, it's halved and you don't have to shoulder that burden. So that would be my big piece of advice. Thanks.